Welcome you all to this industry expert webinar hosted by AcceptCare. Tonight we are featuring Dr. Len Tau. And just for a little context, the format of AcceptCare's Industry Expert Series is that we bring in some of our industry's most trusted experts, and we just spend an hour learning from them. AcceptCare is on a mission to connect more patients with quality dental care. And you will find that most of the industry experts joining our webinars share that passion. For this reason, the primary focus of our webinar series throughout 2024 will be to spend an hour once or twice a month diving into various areas of the practice that could be hurting your case acceptance. And we will take that deep dive with some of the top names in our industry. Throughout this webinar, you will be able to submit your questions using the Q&A, not the chat. So make sure you find the Q&A at the bottom of your screen. We will save all of those questions and throughout the webinar. So just put them in there as you have a question about what Len's presenting. And then last 9 or 10 minutes, we will ask those questions to Len and get some answers for you. So make sure that you're using the Q&A to add some questions. So let's get on the good stuff. Chosen as one of the top leaders in dental consulting by Dentistry Today, Dr. Len Tau has dedicated his professional life to improving dentistry for both patients and for other dentists. He's the author of 2 books, Raving Patients, and also 100 Tips to 100 5-star reviews in 100 days. In December 22, Len retired from clinical dentistry after more than 2 decades to focus all his attention on helping practices like yours increase their revenue. Before retiring, Len operated the Pennsylvania Center for Dental Excellence in Philadelphia, and he also consulted with other dental practices part-time while he was still in practice, training thousands of dentists on reputation marketing and leading also the dental division of Bird Eye. Len also hosts a popular podcast called Raving Patients, and he lectures internationally on internet marketing and social media, but also on how to increase case acceptance. And that is why we have him joining us tonight. Also want to tell you about his Supercharge Your Dental Practice meeting, which is the ultimate marketing and business boot camp. So this is presented at various locations around the country, and once a year you have the chance to join him. So you don't want to miss that later this fall. I went to that meeting for the first time myself last year. Fabulous meeting. So much to learn from other industry experts. Len, thank you so much for joining us, and we can't wait to spend this hour learning from you.
Well, that was a great introduction. I appreciate it, Marla. Thank you so much. And I am excited to present for the next 50 or so minutes the art of the sale, simplifying case presentation and maximizing case acceptance. As Marla mentioned, I do like questions. Please ask questions, and I will be sure to answer them at the end. Right now, I'm going to focus on just presenting the quality product that I like to present. So why should you listen to me? Well, I have some data to share with you. So as Marla mentioned, I ran a very successful fee-for-service practice in Philadelphia for 15 years, producing between $1.2 and $2.4 million annually in a very saturated market. I was a high-quality fee-for-service practice, 16 to 20 patients per day. I worked until 2017, 3.5 days per week. I then dropped down to 2 days a week until I finished my career, 30 to 35 new patients a month. My average case acceptance was 75 to 85%. I had very high fees in my area. My fees were usually in the 85th percentile or higher. 5 total team members. I had 1 front desk, 1 hygienist, 2 dental assistants, and 1 associate who worked 1.5 days a week, the days I did not work. And I do a lot of consulting on these topics. The clients of mine who implement my strategies see usually a 10 to 12% bump in case acceptance within the first 2 months. And you know how much of a revenue builder that can be. So I'm always available for conversations. If you need any help, just reach out to me. My contact information will be provided at the end of the session. So today's agenda, this is what we're going to be talking about. We're going to be talking about defining case acceptance. We're going to talk about when and where the art of the sale begins. We're going to talk about why patients say no to treatments. We're going to be talking about something very near and dear to my heart called active listening, a technique I call disarming the patient. body language skills to use during your case presentations, and then payment power tips. We'll talk about how to get them to pay at the end. What I do during all my sessions is I love this quote. I actually came up with this quote off someone else's quote. Education without action is just entertainment. I'm going to entertain you. I hope I educate you as well, but it's without action, without taking action, it's just entertainment. Okay. I love presenting. I do this all over the country. I'm on the road, 35 to 40 weeks out of the year, but I want my attendees to actually take action because that's what delivers the results. If you see this and you go, that was great, but don't implement it, you're going to have a hard time getting results that way. The goal is to increase your case acceptance overall. So let's talk about case acceptance. There are two possible definitions that gurus, companies throw out there. The first is treatment plan is presented and the patient agrees to the whole treatment plan. That's great if you can get patients to do that. But that's not ideal in my mind. Whereas treatment plan is presented and patient agrees to a portion of the treatment plan that was presented. To me, that's more ideal. So when a patient actually says, okay, you presented me 3 crowns and a bunch of fillings and scaling root planing, I only want to do scaling root planing and the fillings, you have case acceptance. If they say no to everything, they just don't come back to the practice and you may never see them again. So I want the second option here to be your definition. And that's what I guide myself on, which is 75 to 80%, 85% of that. So you want to get the patient to do some treatment. If they do nothing, your case acceptance is going to be exceptionally low. So as this quote says, all or nothing can leave you with a lot of nothing, a little can turn into a lot. I want you to get a little from the patient, at least when they come into the practice. So the average case acceptance from all the studies we see is 35%, which is extremely low. I actually gave a similar workshop about 2 weeks ago, and I polled the attendees and asked them what they thought their case acceptance was. And the average person thought their case acceptance was 60 to 70%, which is super high. There's no way that it's that high. Okay. So hopefully you know what your case acceptance is. But if 35% is average and that's what patients say yes to treatment, that means that 65% are patients who don't accept treatment and go elsewhere or just don't do treatment. So you are letting money walk out of your door. Literally money's flying outside the office. You're losing it. You need to keep that financial end in the practice. So when does the art of the sale begin? And it actually begins. People always, I ask this question a lot during my seminars and I come up with all different answers. When somebody says, well, when you're presenting treatment, yes, but it actually starts on the very first phone call to the practice. You need to put your best foot forward here. You do not want people to lose faith in the practice on that very first phone call. You need the best person answering your calls. In fact, I think the most important equipment in your practice is your phones, and yet the lowest paid people are running the phones. So keep that in mind here. You have to give the best presentation when people call the practice. So the art of the sale begins when someone is really the first interaction with the office, whether it's the phone, as I mentioned, or it could be simply going to your website. And this is an older website, but you need to have chat on your website as well. You want patients to be able to contact you at any time of day. And there's a lot of AI chats out there that will handle the questions, live chats that will handle the questions patients have to ask. But you need to make yourself available for them. And I'll give you an example of how chat helped me. So I live in Florida now. I was commuting back and forth to my practice while I was the owner. And at about midnight, a patient went on the chat and said, do you do veneers? And I was watching TV and I basically messaged her back, sure, what can I help you with? Turns out she had broken some teeth. She wasn't happy with the way her teeth looked after the bonding was done. I was coming up to the practice the next day from Florida, and I invited her into the practice, but she did not believe that I was a dentist chatting with her. It couldn't fathom her that at midnight, the dentist would get on and chat with her, which I do personally all the time. She ended up coming in the next day and spent $14,000 in my practice. So that is how valuable this is. And I have story after story after story about how you need to make yourself available to the patients. And again, this is what the chat just looks like when it opens up. They would message the practice and someone in the office would answer it. That was my job in the practice. So let's talk about why patients say no to treatment, because in order to get higher case acceptance, you need to understand why patients say no to treatment. So Here are some reasons. They don't feel a connection to the office. We are very busy in our practice. So instead of rushing in treatment rooms, slowing down, I want you to take your time to get to know the patients. Ask them about their families, their jobs, talk to them about their oral health goals, and address their concerns. Simply put, if you make the connection with the patients, this will not only go a long way into them saying yes to treatments, but it will also lead to loyal patients who are happy to refer their friends and family to you. So you need to make this connection with the patient. And by the way, just so you know, I'm really referring to new patients here. I'm not referring to existing patients. Number two is they don't find value in what you're offering. So when a new patient comes in, you lean them back and you tell them, hey, you need periodontal therapy, you need a couple crowns. They're not going to accept that blindly, okay? They're not going to follow that recommendation unless they already trust you. And a lot of times these people don't know who you are. They don't trust you yet, okay? You have to educate them about their condition and make sure they understand the possible consequences of ignoring it. So I like to use tools, whether it's intraoral camera, you can use Nitero, you can use photography. You have to create the value for them. People buy in what they value. That is why phones sell out. That's why they buy electronics. That's why they buy baseball cards, because it's a value in what they buy. If they don't see value in what you're offering them or don't see why they need to fix the problem, then they're not going to move forward with treatment. So number one is they don't feel a connection to the office. Number two is they don't find value in what you're offering. Number three is you don't listen. And I told you when I first presented this, I said this is very near and dear to my heart. So I bought my practice in 2007 from a dentist who had unfortunately committed suicide. The team stayed, a lot of the patients stayed, but I hired a coach because I thought I knew how to run a business and I knew nothing about running a business. I knew how to do dentistry. And one of the first things she did was she said, let me see how you do when you're doing case presentation. And she pulled me aside and said, you did great, but you have a major problem. And I said, what's that? She goes, you don't listen. I'm like, you're crazy. I listen intently. I'm a great listener. And she said, absolutely not. So she coached me on something called active listening, which I'm going to talk about in a couple minutes, because that was a game changer. One of the best decisions I made in my life was to become an active listener. And it really changed the way my practice kind of blew up after I started to listen better. I always like to joke around today, so I'm a great listener now, and the only person I don't really listen to is my wife. I have selective hearing for her, but I'm an amazing listener, and you have to listen to your patients, okay? If a patient comes in and says, I want you to fix number 10, but there's more pressing issues, let the patient know, I know your primary concern was number 10, but this, and this take precedent. Rather than ignoring number 10, if you ignore it, they're going to think you don't listen to them. Number 4 is you don't properly follow up. I'm here on behalf of AcceptCare. They sponsored me to speak at this session, and they have a great follow-up, which I'll talk about. But we in the practice don't have great follow-up. It's one of the things when I talk to practices, I say, how do you follow up with them? Well, they make a list. How do you check it? Well, it's random. Or they do a day later, a week later, and a month later they follow up, or 2 days, 2 weeks, 2 months. But there's no way to really track that. So, just so you know, I think that you have to follow up. One of the things I always like doing when patients would leave the practice saying, hey, I need to think about it, or I need to speak to my spouse. I would always ask them, do you mind if we follow up with you next week or tomorrow or a month from now, just to get permission from them? If you get permission from them, that's great. If someone says, no, I don't really want you to follow up with me, or don't call me, you know that you probably are not getting that sale. The patient is not moving forward with treatment. And the last one is you don't offer the right financing. AcceptCare is one that offers all different types of payment options, which we'll talk about, but you have to have the right financing options. You have to make the patients seem like the treatment's affordable to them. But these are the 5 things. To recap, they don't feel a connection to the office. They don't find value in what you're offering. You don't listen to the patient. You don't properly follow up, and you don't offer the right financing. So what I want to spend a couple seconds on here is I want to spend a couple seconds on the listening, what we call active listening. So active listening is hearing what your patients are actually saying. So we're going to talk about these things. So step 1, and you can look this up online, guys. This is something very popular nowadays. When I took it, nobody knew what it was, but now everybody talks about active listening. So the first thing you want to do, active listening is a technique that enables you to fully concentrate on what others are saying and to understand their complete message. That's what the definition of active listening is. And there are 5 steps involved. So the first step is paying attention. Now, how do you show that you're paying attention? You want to look at the person you're speaking with. Be aware of their body languages, ignore distractions. So one of the biggest tips I will give you, and one of the biggest changes in my career, or my life, I should say, was we talk about avoiding distractions. So many of us use Apple Watches or smartwatches, and I would get buzzed or pinged or tapped by the watch when someone needed me in the office or a message was being sent to me during the day, and I would literally look at my watch. I would look at my watch, and patients would say to me, "Are you paying attention to me?" That's what they literally would say, because I would always look at my watch, and I would say, "Well, somebody needed to send me a message." So one of the biggest changes I made in my career was I took off my watch. Now I don't even wear an Apple Watch anymore. I wear a regular watch, and I don't have those distractions. So I highly recommend, if you are wearing one of those watches, when you're doing a case presentation or you're listening to your patient and doing that initial examination, I suggest you take off your watch and put it on the side and show that you're paying attention to them. So the first step is to pay attention. The second step, you want to show that you're listening. So what are ways that shows that you're listening? Nodding, smiling, saying yes, from the time to time. You basically want to encourage the patient to continue speaking. Okay, so what you're telling me is this, or so what you're saying is that. That shows that you're listening. Number 3, provide feedback. Reflect on what the patient is saying and reflect back on them and ask questions to clarify that you understand them correctly. That providing feedback is an amazing way that shows that you're actively listening to them. Number 4 is deferring judgment. This is really important because you want to allow the patient to finish what they're saying. You do not want to interrupt them. What happens when you interrupt them? They forget what they were saying. Do not interrupt them, okay? Slow down. It's an actual discussion you're having with them. You don't have to speed through this stuff. And then step 5 is responding appropriately. So be open, honest, and respectful with the patient. Tell them what you can and can't do for them. Even if you don't agree with what they want, you need to be appropriate. You want to understand the position they're in, and you want to work towards a shared goal. So if you do these things, again, pay attention, show that you're listening, providing feedback, deferring judgment, and responding appropriately. These are the 5 things that you can do for active listening. And you want to make sure that you really hear what the patient is saying. Stay focused and avoid falling back into old habits. But by becoming an active listener, you can increase your productivity. You can improve the relationship with the patients. It will help you get higher case acceptance. So when I learned this, it basically changed my entire career, both personally and professionally. So if you are finding that you're struggling with listening to your patients, I highly recommend just do a Google search for active listening, and you can take online classes. Again, one of the biggest decisions I made was doing this. Okay. So let's talk about something also near and dear to my heart, which is something called disarming the patient. Remember, most patients who come into the dental practice are scared of the dentist. What are they scared about? They're scared of pain. They're scared of the needle. They're scared of not being able to afford it. They're scared of the unknown. And a lot of times the patients come in, they don't know what's going on. So I've created this technique of disarming the patient. When you do these things, the patient will slump down in the chair. There's actually a point. I used to videotape my case presentations, and I noticed when I watched them over again. And by the way, just ask for permission, say, hey, I want to go back and make sure I'm getting everything covered that we talked about. I'm going to record the presentation or our discussion. Are you okay with that? I've never had a patient say no. Okay. So, but you'll notice there's a time when you have your discussion with the patient that they actually start to relax in the chair. They literally slump back and their arms go kind of loosey-goosey. And if you can find a way to make the patient's treatment affordable, they will move forward with treatment. Okay. So this is what I call disarming the patient. And there's a number of steps to, because you want the patient to say yes to treatment. So here are the steps to disarm the patient. I'm going to give you a story about how this actually portrayed in my practice. So number 1, establishing rapport. Okay. Again, we run a very busy schedule. We run from operatory to operatory. We need to take a minute to take it from the patient's perspective. I want you to walk in, introduce yourself, and lean. I don't want you to lean the patient back to get to work and get to know them. The patient's already nervous and may take time to warm up. So you want to leave a lasting impression. And a big part of that is actually conversing with them and really discussing topics that are not dental related. Now, I will tell you, I established rapport with the patients actually by calling them on the phone ahead of time. So one of the biggest ways to establish rapport is to call the new patients before they come into the practice. Okay, why is they will not believe that you're actually calling them and they haven't really become a patient yet. But you can also have a discussion with them that find out what they're looking to do or what their problem is. Okay, get that warm, fuzzy feeling out of the way. So when they come in, they love you and they want to move forward with treatments. So establish the rapport. Okay, get to know the patient. That's the first thing you want to do. That's the most important step in disarming the patient. Number two is asking key introductory questions. So what are some key introductory questions? What brings you into it? Now, these are dental related questions. When you establish rapport, the initial stuff is not necessarily dental related, but when you ask key introductory questions, you want them to be dental focused. So what brings you in today? When was the last time you saw a dentist? Is there a problem during your last visit that you want me to know about? You want to ask these questions of the patient. Are you having any pain? What's your main goal? You got to get all these things out in the open from the very beginning. So don't be afraid to ask key introductory questions. It will help unravel the true reason what the patient is looking for. Number three, establish that time is not an obstacle. So one of the things you do not want to do, okay, or excuse me, one of the things that patients will ask you is, how long will the procedure take? That's a common question. So what I always teach my colleagues, my clients, even my associate, you don't want to answer with, it will take an hour to an hour and a half, because that gives the patient the ability to say, I don't have time, okay, or I can't do it during that time frame. So you want to basically respond by answering the question by basically saying to them that you want to know how much time they have available. So here's an example, and I'll give you a real life example with this. It was day 1 or day 2 that my newest associate who bought the practice a few years later I was having her check the patients in the practice. A patient came in and chipped the mesial incisal facial lingual angle of number 24. Did not need anesthesia. The patient said, how long will this procedure take? And she told the patient 30 minutes. And the patient said, I don't have 30 minutes. And proceeded to come up to the front desk. And I overheard the conversation. And I asked her what happened. He goes, well, they asked me how long it would take. And I told him 30 minutes. I go, well, how long will that actually take you? It would probably take her 10 to 15 minutes. Okay. In the meantime, this patient was the biggest canceller in the world. And I told her that he's probably going to cancel the next appointment. In the meantime, he spent a half hour talking to the person at the front desk, just talking about nothing. So he certainly had time. She just didn't answer the question properly. And guess what happened? The patient ended up canceling the appointment, as I suspected. So if you establish that time is not an obstacle, you are more than likely going to help disarm the patient. Okay. Now, if you truly don't have time, you don't have time. So you want to remove the fear as well. You want to make sure the patient understands, and you tell them, I've done this procedure so many times. I promise patients, I give a painless needle. I gave a painless needle. I worked on that for years to give painless needles. Patients are scared of the needle. I tell patients all the time that they will not feel my injection. I use topical gel, special topical gel. I use a special anesthetic called Sit and Nest Plain, and then followed it up with 1 carpule of whatever I wanted to use. And the patients felt nothing. So you want to remove the fear. Tell them it's going to be a painless injection. They're not going to feel anything. It's simple. It's easy. That you do it all the time. So that's how you remove the fear. If I don't really like the patients, I would tell them it's the first time I'm doing it, and you see them tense up in the chair, but that's only if you wanted to mess around with the patient sometimes. Next one, you want to ensure that treatment can be made affordable to them. And this goes to the fact that patients don't know how much treatment is costing. They don't know if they can afford it. So even during that initial conversation with the patient, I always used to tell patients, I will try to make treatment affordable to them. And I said, just come on in, let me know, what your monthly budget is. So if someone's calling you on the phone, I tell them, I need to know how much you can afford a month. If you tell me that information, I'm sure I can find a payment plan that works for you. If you have no idea what your budget is, I can't help you. And you really can't help yourself. And I always use this example. Patient comes in the office, they have no teeth. They have a huge assortment of treatments that can happen. They can get dentures, they can get a full arch, all on 4, all on 6. They can get upper denture with a lower locators. There's so many options until they tell you that their budget is $500 a month over 24 months. And then you only have $12,000 to work with. You can only do a couple of things for $12,000. So you have to have the patient tell you what their budget is, or it's very difficult to find them a plan that's going to work for them, or even recommend treatment without sticker shocking them. So you want to ensure that the treatment can be made affordable to them. You want to use everyday language as well. Okay. So one of the things that I like talking about is when I did a case or an examination with a patient, I like to use abbreviations. So, and I would tell the patient, you're not going to understand anything I talk about right now, and tell them that. Okay. I used, MOD, DLI, RCT, EXT. I didn't want the patient to know they need extractions and root canals. So MODB, it just goes along with these abbreviations. I tell them, you're not going to understand any of this. I will explain to you fully afterwards what exactly is going on. So just ignore this. Well, when it comes to everyday languages and when you're talking about treatments, what do you want to talk about? Okay. So instead of scaling and root planing or deep cleaning or periodontal disease, you want to use the word deep cleaning, or you want to use terms like for periodontal disease, you want to use, I love the word infection. Patients want infections out of their mouth. Okay. If they had an infection, they wanted it gone. So having a gum infection or a pus, they don't like the word pus either. For a periapical lesion, a pus pocket in your bone. That's what a periapical radiolucency is. But you don't want to call it a periapical radiolucency. You want to call it a pus pocket in your bone. For periodontal disease, call it a gum infection. They want the gum infection out. So that's why I would use everyday languages. I would not use any dental terms when you discuss it with patients. Use analogies whenever possible. Analogies are great. One of the ones I use in practice, I'll give you two examples. When you want to relay how teeth can move when you remove a tooth and you don't put a replacement in, it's like a book on a bookshelf. So when you remove that book from the bookshelf, what happens to the other books? They fall over, and that's what happens to your teeth over a long period of time. Another one for dental implants, as you probably know, in a lower arch, you can do 2 locators minimum. In the upper arch, you need 4 locators minimum. And when I describe why, I call the lower jaw is like a screw going into wood, and you hear it, you feel it grab. Or on top, why you need 4 is like the bone is like drywall, and that's why you need drywall anchors. You need more implants because the bone isn't as good. The quality of the bone is not there. So when I talk about drywall versus regular wood, that analogy patients understand as well. So you want to make sure that you use analogies whenever possible. And then the last one for this, you want to focus on same-day treatment. Same-day treatment is really, really important. So what can you say to a patient when it comes to same-day treatment? Well, you can say to them, the doctor's going to look at you today and we can get started treatment today if you want to, or the doctor's going to take a look at you and we can get started today. Or if a patient comes in an emergency, we would be able to treat your problem today if you would like. Now, why is that important? So there's a couple of reasons. Number one, same-day treatment, to me, it doesn't have to be doing actual treatment. Same-day treatment for me is getting the patients to say yes to treatment, and guess what? Paying for it, and then scheduling an appointment. So you want to focus on today. Try to get as much done today as possible, because when they leave your practice, when they go out, they're going to be bothered by so many different opportunities to go on a cruise, buy a car, buy a new device for their, for their kid, buy a computer. They hit with so many advertisements every single day. You want them to accept your treatment. So focus on same-day treatment. So the other big step in my career was actually learning body language skills. Okay. And that's something that a lot of us don't know. And I studied this one. It was called Albert Mehrabian's communication model. And if you look this up, you can learn more about it. I'm going to go through it very, very, very quickly, just so you know. So Albert Mehrabian's communication model is we plan out what we're going to say and don't give much thought to a nonverbal communication. But if you look, if you look here, you'll see that 55% of what we do is visual, 38% is vocal, and 7% is verbal. But again, we spend so much time on the verbal part, which is only 7%. We don't focus on the body language part of it. So I spent a long time talking about this Albert Mehrabian's communication model, and I highly recommend you look this up and learn it yourself. Again, I'm going to go very quickly through this and review it with you, but I want you to understand these basic body language skills, because people buy from people they like and trust. So there are 3 basic body language tricks that I want to teach you. And I'll go over all of these. So we're going to start with the art of eye contact. So when you listen to your patients, you actually want to squint your eyes. And I'm wearing glasses so you can't see it, but you actually want to squint your eyes, okay? Squint ever so slightly. It's imperceptible, but it's in the patient's subconscious mind, they will register as a nonverbal sign that you are focused on what they're saying. It's similar to the listening point. So squint your eyes. Now, when explaining something to that patient, open your eyes a little bit more. So open a little wider than normal. As insignificant as this may seem, this conveys openness and honesty about what you're trying to say. And then when asking the patient a question, you want to switch back to this slight squint as you ask the question. So you may think this is completely nuts. And I promise you that if you start doing some of these things, that they work. And this takes practice. You have to look into a mirror, or you have to do with someone. You may be cracking yourself up doing these eye squintings. But if you can do this and do this well, I guarantee this changes the way people perceive you. And it's such a small change to your behavior. The other thing I want to tell you is I would make sure you're sitting up. The patient should not be lying down when you're speaking with them. Sit them up, be eye to eye contact, knees to knees, as I like to say. Don't slouch back like this and talk to them. Sit up. Okay, those are some really cool, big, important things I would tell you as well. Now, we talked about eye contact. I now want to talk about head nods, because head nods are really important. So the first type of head nod is a single nod, okay? It reassures them that you are actually listening to them. Again, squints and nods, you're listening, okay? An occasional head bob here and there when a patient is speaking shows that you're actually listening to them, okay? Now, this can be used, as I mentioned, in conjunction with the slight eye squinting, shows that you're listening. Now, multiple head nods, and I'm not talking like a bobblehead, but multiple head nods, okay, shows that or expresses that you understand what the patient is saying. You do not want to nod continuously, it looks stupid, but when they make a big point, you should nod a couple of times to show recognition of the importance of what they just said. So first we got the single nod, the second we have the multiple nod. The third nod is what we call the exaggerated slow nod. And this is the, oh, I see nod. So lift your chin up and put it back down. Oh, I see. Okay. With this nod, you raise your chin and hold your chin back for a second before returning it to its normal position. This is particularly helpful when when there's confusion on either part and it's cleared up. Okay. So it's called the oh, I see nod. And then the one that I really did well at was the imperceptible suggestive nod. Okay. So the power of suggestion lies in this nod. When asking a patient a question, you want them to answer positively, give a tiny nod at your beginning of the question. Your patient will probably not even notice it, but their subconscious will, and they would more likely respond appropriately. So it is, if I was able to get you some financing, are you going to go ahead and accept treatment? You do that and it's imperceptible. The patients are obviously going to say yes to that. So first you got eye contact. Again, you may think I'm nuts. You may be laughing at me sitting in your home computer watching me do this or on replay. This works, okay? The third is I want you to smile. So we are dentists after all, so definitely want to show your smile. So the first time you see a patient and you greet them, you want to use this big toothy smile as much as possible, especially if you have really nice teeth. So I had actually cosmetic dentistry done many years ago. I had a yellow front tooth from getting hit. So my veneers look great and they still look great. So I wanted everybody to see my smile, okay? So one, it shows you're happy to see them, but two, it also reminds the patient they're at a dental practice. So don't be afraid to smile. So the second thing is when listening, you want to put the corners of your mouth outward just enough to where you feel pressure. Okay, so that is basically the when listening smile. So again, when you're listening, you want eyes, you want nods, you want smiles all together. Just like that. Okay. And then when nodding and understanding, give a small closed mouth smile where you acknowledge that you understand them. It's the oh, I see moments that a toothy smile will work well as well. So these three basic body language skills will go a long way. Again, it's called Albert Moravian's communication model. If you learn these three things, you will, again, and you do active listening, these are all things that took my career to the very next level. And I highly, highly recommend you at least consider learning about this. It's going to take some time, but as they say, practice makes perfect. So I want to use some of the time we have remaining to talk about power payment tips, because actually getting the patient to say yes to treatment is really important. But prior to prior to me doing that, I actually want to recap something, and I want to tell you a story about what happened in practice and tell you kind of how it all came about. So this was during a little bit after COVID. So it wasn't during COVID, but a little after COVID. I got a call from a patient. Her name was Trish, and my front desk came up to me and says, Len, I think you need to speak to this patient on the phone. They want to see you for a virtual consult. And again, this was after COVID, so we weren't doing virtual consults. But I got on the phone with her. I said, hi, this is Dr. Tau. How can I help you? And she said, my name is Trish. I am phobic of the dentist, completely phobic of the dentist. I want to come in for a virtual consult. So I was like, can you tell me why? And she goes, because I'm terrified of the dentist. So I said, can you tell me what happened? What's wrong? She goes, I literally was sitting, ready to eat dinner, and a lower front tooth basically fell out of my mouth. And I said, did you bite in? No, it didn't bite into anything. It just fell out. Now, in your mind, you know that there's something not right there. So in my mind, I figured she had significant gum disease. She had lots of problems. I said, look, I can't diagnose it over the phone, but I can promise you, if you come into the practice, we will only take x-rays, we will only talk, and we will put a plan together. Okay, so I reassured her that her fear of having discomfort would not happen that first visit or ever, okay? And she said, fine, I'm okay with that. And she made an appointment for the next day. So before I closed the phone down, I said to her, I need you to do me a favor. I need you to come up with a budget so I'm able to put together a plan that works for you so you can be able to afford it. So now I've disarmed the patient. I told her I can make the patient affordable. Those are two of the main things I talk about. So she came in the next day, and as suspected, she had some massive periodontal disease. All four lower anteriors needed to come out. She didn't want implants. She said, I do not want to have any implants placed. So we did a 6-unit bridge. She needed scaling and root planing. She needed some fillings, and she needed a couple of extractions. All told, her treatment was about just over $11,000. And she said to me, do you remember you asked me to figure out what my budget is? And I was like, yeah. She said, my budget is $500 a month. So I was able to get her 24 months no interest financing, which is $12,000. And she started treatment that day. We got payment, she paid in full, and we made a plan for her to move forward with treatment. That is how all of this kind of envelopes everything that I talk about, because I spoke to her on the phone, which is rare. I discussed money with her, which is even rarer for me, for a dentist. I always talk money, by the way, guys. It was me. I was the financial advisor in my practice, financial coordinator. I didn't have anybody else. I didn't trust my front desk person. I was really good at it. So I want to spend some time talking to you about these power payment tips. So first off, I want to ensure that you are always offering a variety of different payment options. That's really important, okay? You have to offer a variety of different payment options. So the options should be as follows. Number one, you want there to be no interest or interest financing plans. So if you're able to do it, no interest obviously is great, okay? Because the patient has no interest. Okay, now the negative with that, or the negative perception is that the practice has to pay the financing for the patient. And I'd rather have 85 or 90% of something than 0% of zero. And if you don't offer them financing options, they can't move forward, they can't afford it. So now, why did I ask patients how much they can afford? Because if they tell you that I can afford $300 a month over 24 months, that's $7,200. Okay, you have to know your numbers. Okay, so if $7,200 and their treatment is $12,000, they cannot do no interest financing. It's just not available to them. So you have to use interest financing plans that they pay an interest and you're paying a less of a percentage to get them the loan. So no interest or interest financing is number one. A discount for full advance payment up front, half the balance up front and half upon completion if you want to do that. What I did with Invisalign was half down or more than half down, and then payments over 12 months. You can offer a membership plan for discount and loyalty. I had what was called the Oral Health Savings Plan. And you want to also ensure that you take all major credit cards. Now, I'm going to give you one tip here when you present treatment to patients. I always like presenting all different options to them, but I always started with no interest financing first because it was the cheapest payment. So option one with me was no interest. Number two was half and half, and number three was payment in full. Because if you gave them the payment in full option first, you may scare them with the cost of the procedure. A lot of patients like it being paid upfront. So you want to make sure you offer them the options, but start in that direction. Okay. So we're here, and I want to I didn't thank AcceptCare at the beginning, so I obviously want to thank them for having me here. I am and I didn't mention, I'm very big in the third-party financing space. I think AcceptCare is an awesome solution. So I want to just walk you through some of the stuff they have here. So as we talked about, the conversion dilemma is only 35% of treatment is accepted by patients due to lack of affordability and or available payment options. So we have two problems here. There's a poor financial presentation. In my case, I was the financial line treatment coordinator. It was me. Most doctors don't do that. You have someone doing it for you. And the reason I did that, by the way, guys, was that when I had my office manager go in and do it, she just wasn't very good. So I took it over. And as we know, fees shown on treatment plans from the practice management software don't show how affordable a treatment can be. It just gives them a cost. And I hate those treatment plans. I hate what comes out of Dentrix, just so you know. Okay. And the treatment coordinator, financial coordinator have to be knowledgeable and explain all the payment options. And we also have limited payment options for patients. You have only offer pay in full or figured out approach, which I talked about. I offer all three of them. You have a single lender option that requires an app to be completed for each lender, which is a problem. And you have in-house financing not necessarily being offered to the patients. And whether you do that or not, I would limit it to only a few payments, 1, 2, or 3, or if you're doing a Disarm, like I said, over a 12-month period. So the other reason, financial reasons for low case acceptance is the payment options you offer and how the patient's options are presented. When you buy something online, almost everything you buy now has a pay over time. So buy now, pay later. There's all these different companies now. Affirm is one of them that does this. So you want it by showing a patient a monthly payment option next to the pay in full, it actually increases the likelihood of a sale by more than 20 to 30% and increases the average ticket size by more than 50%. And that was from a source called Payments, PYMTS. So I highly recommend that you consider using a buy now, pay later option. And this is how AcceptCare presents the treatment. It actually gives them 3 different options. And they call it keep it simple, you pay in full, you get a little bit of a discount from the amount of money that's presented there. You can do some easy payment plans up to your judgments. And you can do affordable, which is no interest. So you give them all the payment options in one particular place. So the easiest, most effective way to present treatment plan is using, in my opinion, AcceptCare. So they do integrate with your practice management software, which is amazing. Okay, patient sign with treatment consent forms. They can view all the payment options on the screen at once, which is spectacular. And there's very few companies that actually do that. The nice thing about it, if they are going to do third-party financing, it's one application sent to multiple patient financing companies at the same time. So it is truly only one application. They can view their costs and options from any device. And then I think it's great, and I'll show it to you. I already talked about how one of the reasons why patients say no to treatment is you don't follow up. This has an automated follow-up in there that shows the patient's ability to what they cost and how they can pay for it. So patients of all credit scores can apply for financing and choose what works for their budget. So again, one application, they have 0 APR for 6 to 24 months, just like the standard companies out there. They can offer a fixed APR, so with interest for up to 72 months. And it also includes compassionate financing, which is an in-house financing solution that I used in my own practice, where you, the dentist practice, make money on the interest. And they have the lowest discount rates in the industry. So as I mentioned, I love the fact that they follow up. And this is huge for someone like myself. So patients who have pending treatment will receive a link to view and pay or financial treatment via the SMS and email. So text message and email. So it's 1 day after a treatment is presented, 7 days after the initial email or text message, every 30 days, and it's sent until the patient accepts or declines treatment over a 90-day period. And they find that over 30% of patients accept treatment after leaving the office. And this is spectacular because, like I said, this is one of the reasons why patients say no to treatment. So they have a 32% planned acceptance 7-day post presentation. And that's I also love. So I'm a huge fan of analytics. I think knowing your case acceptance, which most of us don't know, is key to improving it. Okay, so they have powerful reporting and analytics. They will allow you to track the metrics that you need to know that you're actually improving, like same-day case acceptance, same-day cash acceptance totals, and more. And they're integrated in Dentrix, EagleSoft, Open Dental, and they have automated payment posting to save your team valuable time. So overall, AcceptCare has been proven to drive greater case acceptance and revenue outcomes. So 67% average case acceptance based on cases presented, 49% average case acceptance based on dollar amount of cases presented, 14% higher case acceptance than the industry average, 100% of patients receiving monthly payments will complete treatment using the systems that you recommend. 32% patients accepted and paid via text message and email 7 days after a case presentation, which I mentioned, and 8.4% average MDR for 3PF. And I'm sorry, I don't know what that stands for. So someone can clarify that for you. I was reading that, I was like, yeah, I don't know what that means. So I want you, remember at the very beginning, I presented you with a goal to some extent that I want you to take action. We have a bunch of people, over 50 people in this presentation. I want you to reach out. I want you to scan this QR code. I want you to visit AcceptCare.com and set up a meeting to learn more about this product. If you combine this with the tools that I just taught you, disarming the patient, talking about eye blinks and nods and smiles, and you do everything I talked about, you will have a huge change or huge increase in your case acceptance. So as we end, we should be just about 50 minutes in or within a couple minutes of that now. The art of the sale starts with the very first patient interaction. You want to listen to your patients, very, very important, active listening. If you can disarm the patient, they will accept treatment if and only if you can find an affordable payment option. Body language can help increase trust with your patients. And you want to use third-party financing, aka AcceptCare, to your advantage. They give all the options available to the practice, and they present it in one way so they can see all the different options and they can choose what works best for them. So a few things about myself. I'm going to do a little bit of self-promotion here. Number one, Marla mentioned I have a podcast. It's called Raving Patients. It comes out Fridays at 5 a.m. I'm currently in season 7. I'm not a sales guy. I'm not salesy on these types of things. So it's purely educational. It will help you grow your practice. All I ask you is to listen to one episode and see if you like it. They're 30 to 35 minutes long. But this is a QR code to scan, and you can actually go ahead and listen to an episode and see if you like it. I have a Facebook group called Raving Patients. I'm all about online reviews as well. So this is a very safe haven to post your negative reviews. People in the group will respond. There's no judgment. Nobody will tear you down if you got a bad review. It happens to everyone. But this is a QR code that takes you to the Raving Patients Facebook group. You can join if you have a friend already in the group. It will automatically let you in. If it asks you to provide details, just say, hey, you saw me in the Art of the Sale hosted by AcceptCare, and I'll let you into the group. I have a book. I have 2 books actually, but this book I can actually give you for free. I am going to show you a QR code here in a second. It's right here. I love to get feedback. I'm a review guy. I teach how important feedback is to my attendees. So if you want to scan this QR code and then enter the code RAVING into the screen and take a couple of minutes just to give your feedback to me, it sends me a report at the end of the session. The good, the bad, and the ugly about it. If you liked, what you didn't like. And if you want me to improve anyway, I speak all over the country so many times. I use this as really good for me to help improve my presentations to people. So if you would be so kind, but if you do fill this out, it will send me a link, a message that you filled it out, and I will send you a copy of my book via the email. It's an electronic version of the book, but it will give you an ability to unlock it and read the book. So I would appreciate it if you take a couple of minutes to do that. And this is my contact information. So if you scan this, this will give you all of my contact information. Here's my email and my cell phone number. For people that know who I am extremely responsive, almost to a fault. If you send me a message, I should respond within a couple of minutes max, and you can test me on that. But I'm happy to answer any questions you have. I'm happy to speak with you at any point. You can just reach out to me if you're looking for some assistance in growing your practice. I work individually or practices on this as well. And I want to pass the baton back to Marla. Thank you so much for joining me. I hope you enjoyed the presentation.
Thank you so much, Len. Lots of great information there. And I know that the audience is super appreciative. We do have a few questions. So first of all, you spoke about taking time to make connections and really talking with your patients. So the question is, do you schedule additional time per appointment, or do you coach your team to slow down and make that a priority? How do you make sure that there's time for that extra connection during visits?
So the initial connection I make is on the phone. So I made it a point to call the patients ahead of time if my team felt it. So hygiene I didn't do. Hygiene was a separate situation. If they were a new hygiene patient, I didn't call them. But if they were coming in for a consultation with me, I would almost always, I should say, call the patient and introduce myself, tell them that I'm welcoming them to the practice, wanting to just learn a little bit more about what's going on. So that's where I started the connection with them, obviously, and that saved time in the practice. So they already knew who I was. I already knew about them, and I'd spend 15 minutes on the phone, but it saves a boatload of time in the practice. You need to schedule more time if you're going to do that in the practice. Just be aware of that. So you need to find the time in the schedule. 15 minutes, you should be able to be fine. So to be able to find the additional time to really create that connection with the patient.
Yeah, great. So do you mind, Len, stopping sharing your screen so they can see our beautiful faces?
I can definitely stop sharing. There you go.
Awesome. There you go. So there was a question about the merchant fee for using AcceptCare. We would be happy to provide of course, an overview, and I'll give you a QR code for that in a minute, where we'll talk about all things AcceptCare. There was also this question about why is AcceptCare different than third-party financing, and I'd love to address that question. That what we know is that if you're not putting multiple payment options in front of every patient, if you're not giving them open choice to where they can choose what works within their budget, then you're missing the point. So AcceptCare just really gives you a seamless option to put those patients in front of the payment options in front of every patient. And then there's also a multi-lender network that is associated with that. So you're not just limited to one option. So we would love to share that. I'm actually going to share my screen here and show everyone a QR code. If you are interested in learning more, we're actually giving an offer for anyone in this webinar tonight that we're going to let you try AcceptCare for 90 days. So just scan this QR code, and there are a little bit of some requirements here that you are using AcceptCare for every financial arrangement, financial presentation, and that you're following our kind of configuration. So we're happy to talk to you more about that if you do want more information just about AcceptCare and the fees and all of that. So I do think there may have been a couple other questions. Let me get to this. So how many times should we follow up on unscheduled treatment plans? So talking really in general about the follow-up, that if they have not scheduled yet. So Len, would love to hear your thoughts on that. I certainly have some thoughts about that too.
Yeah, so again, I think most importantly, you have to ask for permission from them to follow up with them. If they don't want to be followed up, don't follow up with them. They just don't want it. If they give you permission, I would do it over a 90-day period. I would either follow 1 week, I think I used to follow the 1 week rule. So one day, 1 week, 1 month. That means you do it at 2 weeks, and then you do it, after the month, you repeat the process again. So you're basically reaching out to them potentially 9 times in 3 months. After that, if they haven't accepted treatment, they're not doing it. If they're a new patient, they probably aren't coming back into the practice. If they're an existing patient, you just wait till they come back 3 or 6 months later for hygiene and try it again. I mean, you don't want to annoy a patient so much. So just keep that in mind. I know that AcceptCare has an email and text that they send out, and they do it over a 90-day period. So I think that matches up. But I'll let you kind of talk about that also, Marla.
Yeah, and I think the real key here is so many practices have the best intentions to follow up, but if they don't have a system in place to kind of help with that, we're not saying don't ever follow up personally, but you have a system in the background that's always going to work, and then the practice can supplement that. One more question about AcceptCare. Does AcceptCare provide any ongoing training from a financial coordinator based on this presentation? And yes, we actually absolutely do have an implementation process and training. So we're going to help your team, fully implement. So we'd love to speak with you more about our training process. So that is it for our questions tonight. Len, I appreciate the hour with you. And so those of you who've joined us, we do have more industry expert series coming up. And as I mentioned, our focus for at least this first part of 2024 is really going to be about case acceptance, getting the yes, And it's not all going to be, just about AcceptCare. It's going to be about all those processes that help you get the yes. So I really hope that every one of you will come back and join us for some other industry experts. Len, you've been fabulous. One other person is asking for the QR code again, so I'll share that as we go out. And once again, thank you so much to everyone who spent this evening with us, and we look forward to seeing you next time. Thank you, Len.
Thank you for having me. I appreciate it. Hope everybody enjoyed it.